Today we are at Arkansas Surgical Hospital. I'm joined by Dr. Sam Moore, who is an orthopedic surgeon. We're talking about patient-specific orthopedic solutions, and we are at the hospital, but I guess we should mention that your clinic is just right across the street, right?
That's right, yeah. We actually built a clinic in 2024, moved in October, and we're real happy to be right here close to the surgical hospital. Our therapy is there, so it's real convenient to have patients that are having surgery, or maybe they're not having surgery and they just need to get into therapy, but it's nice and close.
When a patient comes to see you, if they have joint pain or some other pain, you talk to them about non-surgical options first. Is that correct? Walk me through that.
Right, yeah. So we really want to start by treating, when we're talking about joint pain or especially arthritis, we just see a lot of that. Arthritis is one of the more common sources of joint pain. We're talking about non-surgical treatment most of the time. I mean, we're starting with just mobility. The things that limit people's function are going to be stiffness and weakness and pain. So we want to get them in therapy. We want to have home exercise routine, and we're really focusing on that, strengthening, that stretching, and my patients kind of get the stretch lecture a lot. So warning, if you come see me, you're going to get a stretching lecture. That's because it makes such a big difference with non-surgical pain, non-surgical treatment for pain. So,
if somebody does end up needing surgery, what are custom fit total joint implants?
Yeah, so everything we do when it comes to surgery, we're doing it with precision, focused on the patient's fit, the patient's size, and restoring function. If I can get their anatomy to be replaced with an implant that's made specifically for that size femur or tibia or whatever the bone is that we're working on, then we're going to have quicker restoration of motion. And really the implants are part of it. The approach that we use is even more critical. And so we do a muscle sparing approach. When I do hip and knee replacements, we're not cutting muscle. We're doing a muscle sparing approach so that patients are moving quicker, patients can bend and flex quicker, and that's really critical for early pain relief and function.
Explain to me how a robotic total knee replacement works.
Yeah, so again, on not just the implants we use, but the way we put the implants in are really, that's really where we've made a lot of progress in the last 20 years. We're doing the same surgery, whether it's with a robot or with manual instruments. The robot gives us a little more precision. The goal is to get more mobility early, but ultimately, we don't know what the 30-year data is. We've done robotic total knees since 2015 in the U.S. We did partial knees since 2007. That technology is great, but we don't know what the long-term results, and we really hope that we're getting the more precise we're putting these in. Just like with manual instruments, we're trying to be very precise. We really hope that means the implant lasts longer. They have a great outcome and a full balanced knee with good range of motion.
Who tends to be the better patient for a robotic knee replacement or just a robotic surgery in general? Yeah,
I do all of my knees with robotics.
Okay.
If the robot's available. Most of the time it is at the facilities I work. But the point is that I feel like it's a great tool. It's really, I'm still doing the surgery, but the tool is more precise than the manual instruments.
If viewers at home are watching this and they're putting off coming in because they have that joint pain, what would you tell them about when is the right time to come and see a surgeon?
That's a good question. Yeah, I get that question almost every day. The answer is I'm not in a rush. At some point, this is irreversible degeneration though, so we want to kind of make that decision of whether you need a surgery on, is it bad enough to go out for a surgery and be put to sleep and accept the recovery, and is it convenient? You're going to have some support around you, some help at home, maybe with some meals and laundry, even if it's not a lot of help in the house, like staying with you. You do need some help with those first couple weeks, getting a ride to therapy and that kind of thing. It's not everyone who has arthritis needs a surgery. There's a lot of people that have their arthritic joints and they live their whole life without having a surgery. But the point is, if that arthritis is really invading on your lifestyle and you can't be active, we're not winning. Our goal is to have active patients and to keep you active, whether that's a person who can't even walk to the bathroom without pain, or an athlete who's trying to play golf 4 times a week and they can't because they hurt.
Sure.
The goal is stay active. My goal of our practice is to keep you that way.
Where can viewers go for more information?
Okay, yeah, thanks for asking that. You can go to my website, drsamuelmoore.com, or arksurgicalhospital.com. It's a great information source for you, and anyone is interested.
Perfect. Dr. Moore, thank you so much for your time. Really appreciate it. We'll have more Good Morning Arkansas after this.